नमस्कार, हम हैं आदित्य और सौम्या।
और आपका स्वागत है घटना चक्र के इस नए और ज्ञानवर्धक सफर में।
Welcome, curious minds, to another deep dive.
Great to be here.
Today, we're plunging into a topic that, well, for many people is a source of really intense pain and honestly a bit of a mystery. Kidney stones.
Definitely something that causes a lot of distress.
Exactly. So our mission today is to really unpack what kidney stones actually are, why they form, who's most at risk, and crucially, what can really be done about them.
Yeah, getting past the jargon.
Right. We want to cut through all the medical speak, get to the core insights, and trust me, there are some genuinely surprising facts and recent trends we absolutely need to talk about.
Especially regarding younger people, I believe.
Yes, particularly how they're affecting younger generations more recently. Okay, let's unpack this.
Let's do it.
So, first things first, the fundamental question, what exactly causes kidney stones to form in the first place? What's going on in there?
Well, at its very core, what we're really talking about is the crystallization of certain substances. Often it's oxalates.
Oxalates, okay.
Yeah, think of oxalates as these natural compounds you find in lots of plants. When they get too concentrated in your urine, they can bind with calcium.
Ah, right, calcium oxalate.
Exactly, and they form these tiny hard crystals. But, to give the broader picture, kidney stones, sometimes called renal calculi or nephrolithiasis, they generally form when various minerals and acidic salts that are normally in your urine just gather in excessive amounts.
So too much stuff, not enough liquid, basically.
That's a big part of it. It leads to these crystal formations.
Okay, so if it's about concentration and crystallization, does that mean it's all just one kind of stone we're dealing with? Or are there different types?
Oh, that's a really critical distinction. No, it's definitely not just one type, not at all.
Okay.
The most common type, by a long shot, are calcium oxalate stones.
Right, you mentioned those.
Yes. And these form, like we said, due to an excess of oxalate in the urine. And you find oxalate in surprisingly common foods, things like tea, chocolate, even spinach.
Wow, stuff people eat all the time.
Exactly. Now, it's not usually about completely avoiding these foods, let me be clear. But it's understanding that if you're someone who's maybe predisposed to these types of stones.
Then you need to be careful.
Right. Concentrated consumption can be the trigger. Like drinking multiple large glasses of iced tea every single day, or having spinach constantly without balancing your water intake, that can significantly increase the risk.
So moderation and dilution are key.
Precisely. It's not about total prohibition for most people. Then you've also got uric acid stones.
Okay, what causes those?
Those are often linked to diets high in protein, and significantly, dehydration plays a big role there too.
Dehydration again. Seems like a recurring theme.
It really is. Then there are struvite stones. These are specifically connected to urinary tract infections, UTIs.
Ah, so an infection can actually lead to stones.
In this case, yes. And finally, there's a rarer type called cystine stones. And these are caused by genetic factors, inherited conditions.
That's fascinating how the causes really do vary depending on the specific type. Makes sense.
It does.
Okay, here's where it gets really interesting for me because, like we hinted at, we're not just talking about a general medical condition here. There seems to have been a significant recent uptick in cases, right?
Exactly right. There was a recent report from experts at the Asian Institute of Nephrology and Urology, AINU for short,
Okay.
and they highlighted a pretty concerning trend. A significant...
Younger population. How young are we talking?
primarily in the 20 to 40 years age group. And interestingly, they noted it happens especially during the summer months.
Summer. So heat and dehydration likely play a part there.
Absolutely. What's fascinating here is how this connects directly to the most prominent reason AINU identified.
Which was?
Dehydration, or just insufficient hydration, really, along with some other, let's say, problematic habits in that 20 to 40 age group.
What kind of habits?
Well, we're seeing trends like maybe higher consumption of sugary drinks, processed foods, perhaps less consistent access to just plain water during the day, maybe a more sedentary lifestyle for some. It's likely a combination.
It's really striking that the AINU report points to dehydration as the most prominent reason, especially in younger people. We hear so much about diet, but is hydration really the bigger lever here? And why might younger folks be struggling with it more now, do you think?
Look, it absolutely is a major lever. Diet definitely plays its part. We can't ignore that. But adequate hydration is just fundamental.
Why fundamentally?
Because it directly impacts the concentration of those crystal-forming substances in your urine. Less water means higher concentration. As simple as that, really.
Right, right. Dilution.
Exactly. As for why younger people might be struggling, well, it could be several things, couldn't it? Less conscious effort to drink water, maybe relying more on coffee or energy drinks, which can sometimes be dehydrating, or even just being more physically active but not compensating with enough fluids afterwards.
That makes a lot of sense. Okay, so given how painful these things are reputed to be, what do doctors actually do to diagnose them? And can you maybe describe the experience for someone who hasn't had them?
Sure. So common diagnostic tools are things like ultrasound and CT scans.
Yeah.
They're very good at pinpointing the stone's location, its size, getting a clear picture.
Okay.
As for the experience, look, the pain associated with kidney stones is notoriously intense. It's actually so severe it has its own medical term, renal colic.
Renal colic. Sounds serious.
It is. I mean, I've had patients describe it as worse than childbirth, worse than a broken bone, truly, truly debilitating pain.
Wow. Worse than childbirth. That really puts it into perspective.
It's not just a tummy ache. It's often an emergency room level pain that literally brings people to their knees as that stone tries to pass through the ureter, those very narrow tubes.
That sounds awful. So when someone's in that kind of agony, what's the immediate treatment? Is it always surgery? Do they have to cut them out?
Thankfully, no, not always. For smaller stones especially, one very common procedure is called lithotripsy.
Lithotripsy. What's that involved?
It's actually pretty neat. It's a non-invasive process. They use high-energy sound waves from outside the body focused on the stone.
Sound waves to break it.
Exactly. To break down the stones to much smaller, almost sand-like pieces. This makes them much, much easier to pass naturally through the urine.
Ah, that's a huge relief to hear there are non-invasive options. Okay, so let's pivot then. Prevention. What can our listeners actually do in their daily lives to try and avoid this whole painful ordeal?
Right. Prevention. It really ties back strongly to the type of stone you might be prone to, if you know.
Okay.
For those really common calcium oxalate stones we talked about,
Mm.
well, being mindful of your intake of those high oxalate foods is key.
The spinach, peanuts, tea, chocolate.
Exactly. Again, usually it's about moderation, not total avoidance unless a doctor specifically says so. But here's something that often surprises people.
Oh, what's that?
An excess of vitamin D.
Vitamin D. Really? But isn't that supposed to be good for you?
It is, but too much can actually increase the likelihood of certain stones, mainly because vitamin D plays a significant role in how your body absorbs calcium.
Huh. That is eye-opening. So many of us are told to take vitamin D supplements, especially in certain climates. It sounds like there's a delicate balance then.
There really is. It's a classic too much of a good thing scenario.
So what's the practical takeaway? How do you optimize without risking stones?
Well, vitamin D is crucial, no doubt, but taking mega doses or maybe combining multiple supplements without checking your levels through blood tests, that can sometimes push calcium absorption too high in a way that predisposes certain individuals to stones.
So it's about appropriate dosing, maybe getting levels checked.
Yes, exactly. We sometimes see issues when people are supplementing without that medical guidance, maybe misunderstanding the dosage recommendations. It's just a key reminder that more isn't always better, especially with vitamins like D that your body stores.
Right, the fat-soluble ones.
Precisely. Think of it like trying to improve your car's engine by just pouring in way too much oil.
Yeah.
It doesn't help, it just causes other problems.
That's a great analogy. Okay, so bringing it all back around, especially to that point about the younger demographic and the rise in cases, what does this all mean for our daily habits, particularly thinking about the absolutely crucial role of water you keep mentioning?
Yeah, this raises that really important question. Why is water intake so incredibly critical? What's the mechanism?
Exactly.
The reason a lack of water boosts the risk is actually pretty straightforward. It just leads to a significantly higher concentration of minerals and salts in your urine.
Makes it thicker? Sort of.
Essentially, yes. When the urine is more concentrated, these salts and minerals form crystals much more quickly, much more easily. It really paves the way for stones to develop and grow.
It's like trying to dissolve sugar in just a tiny bit of water versus a big glass, right?
That's a perfect way to think about it. The larger volume of water keeps everything diluted and much less likely to clump together and solidify.
Okay, so let's try and summarize this deep dive then. We've definitely learned that kidney stones aren't just one single problem. They come in different flavors, you could say.
Different types, yes, each with specific causes.
Right. From the really common calcium oxalate ones linked to certain foods and, surprisingly, maybe too much vitamin D.
To the rarer genetic cysteine stones and those linked to infections or high protein intake.
And we've seen how factors like diet and especially hydration and even specific vitamins, they all play these interconnected roles in whether stones form.
And thankfully, also in how we might prevent them.
Exactly. So understanding these different types and their unique causes really feels like the essential first step towards, safeguarding your health from this.
Absolutely. And if we connect this to the bigger picture, it just highlights how seemingly simple daily choices can have such a profound impact.
Like just drinking enough water.
Precisely. Things like consistent hydration, making thoughtful dietary choices. These can have a huge long-term positive effect on our health. It helps us potentially avoid a condition that, as we've discussed, can be incredibly debilitating. It's just a powerful reminder, really, of how our bodies are constantly working to maintain this delicate balance.
And how easily our habits can disrupt it, I suppose.
I said exactly how easily we can disrupt that balance, sometimes without even realizing it.
Absolutely. It definitely makes you think twice about reaching for that next glass of water, doesn't it?
Truthfully.
Keep that curiosity flowing, everyone, and we will see you on the next deep dive.